Hello everyone, welcome to Ashur Medical Institute. I am Dr Kishore KV. I am neurologist. So as part of bedside neurological examination video series, so in this video we'll be taking cranial nerve examination, specifically the second cranial nerve, the optic nerves. So these video series we will be looking only into the examination and nothing more. Okay, no diseases will be dealt with, no detailed anatomy or physiology or anything will be dealt with. That will be a separate video. So here we are just looking into the examination, the prerequisites and the methodology, and any important points to be noted which I've learned from my seniors, from my practice, and okay, over the years. So coming to optic nerve examination, so it is light reflex, visual acuity, color vision, visual field testing, fundus examination by direct ophthalmoscope. So these all these can be, and we are usually doing bedside. So what are the prerequisites for bedside optic nerve examination? So we need pen torch, ophthalmoscope, Snellen's and Jaeger's chart, Ishihara's chart, and either pen cap uh, for confrontation method. So eyes to be inspected first and to look for conjunctiva, sclera, any corneal opacities, cataracts, inflammation, or any other abnormalities. Initial inspection has to be done of the eye. Then only we should move on for optic nerve examination. So each eye to be tested separately and the non-testing eye to be closed. This is very important point which we will usually forget during our examination, and the examiners will be making note of it. So coming to light reflex, to be tested in dim room, gently point the focal light into one eye and observe for the magnitude and the speed of pupillary response of the direct eye. Okay, so for example, you are flashing a light into right eye, so we'll observe the right eye for the pupillary response. So what all you observe, whether the pupil is contracting, and if it is contracting, what is the magnitude and what is the speed. Okay, there are many grades, 0 to 4. The 4 is usually normal and 0 is there is no response. Okay, and after a few seconds break, gently point the focal light into the same eye and observe for magnitude and speed of pupillary response of the opposite eye to look for consensual reflex. So for example, you are flashing the light into the right eye, and this time you have already observed the direct reflex, and this time you will be observing for consensual reflex in the left eye. Same, the magnitude and the speed of pupillary response has to be noted, and you have to repeat the same procedure with the other eye. For example, you flash across the left eye, look for direct response and give few seconds break, again flash across left eye and to look for consensual reflex in the right eye. Okay, so this is the examination of right light reflex. So coming to next, the visual acuity. So from neurological point of view, the best corrected visual acuity is more important. We are not worried about refractory errors in neurology, even though it is important for a patient, but from neurological point of view we are not worried about refractory errors. So we will be testing with their best corrected vision with glasses. So we'll test near vision by Jager's chart and far vision by Snellen's chart, and usually we will be one eye to be open, the other eye to be closed during this testing visual acuity. Coming to color vision examination, Hishihara's chart to be used for color vision, the brightness and intensity of color to be compared with each eye. So for example, right eye, if you ask the patient if they are able to identify a color, and left eye also they are able to identify, you have to ask them any difference in the intensity or brightness of the color, whether any difference is there in the each eye. This is very important, which we normally don't ask. Okay, and this is regarding the color vision examination. Coming to visual field examination by confrontation method, which we normally do in clinical setting, and normal visual field extends to 90 to 100 degree temporally and about 60 degrees nasally, 50 to 60 degrees superiorly, and 60 to 75 degrees inferiorly. Okay, so the patient and examiner should be at the same eye level, gazing eyeball to eyeball at usually 1 meter distance. So for example, the right eye of the patient and the left eye of the examiner will be tested, and the other eye will be covered. Okay, so the targets are brought into the visual field across various meridians and should appear to both people simultaneously in all parts of the field, assuming the examiner's visual field is normal. So this is an assumption that examiner's visual field is normal, and hence we expect that for patient also the object across various meridians should appear simultaneously. So coming to most important, fundus examination by direct ophthalmoscope, which we usually do bedside. What all we have to look at? We have to look at disc, macula, arteries, veins, and peripheral retina. For disc, we have to look at cup and disc ratio, look for any edema or any atrophy. Look at macula for edema, hemorrhages, soft and hard exudates. Look at artery for caliber, and veins mainly for venous pulsations. And we look at peripheral retina for edema, atrophy, hemorrhages, soft and hard exudates, and any pigmentations. So this will complete fundus examination. We have to note down all of these are normal or not. If abnormal, what are the abnormality and where it was found. So important points here is light reflex assess only the anterior visual pathway. Hence, in cortical blindness, right reflex will be normal. Visual acuity abnormalities can be due to cornea, lens, the medium, the retina, optic nerve, and its pathway till the cortex. So it is pretty non-specific. Color vision mostly localizes to retina and optic nerve, and the field effects help in localization along the visual pathways. So these are the important points to look for in our examination, and for us to localize and pick up things, the color vision and field effects will help very much. Thank you.